Hello everyone, today I'm going to be talking to you about exercise and concussion rehabilitation. Specifically, I wanted to look at, does resistance and aerobic exercise improve the recovery time after a sports-related concussion? And my overall kind of motivation to this was that I felt I had a lack of knowledge as to any type of alternative treatment options there were for individuals with concussions, and I wanted to see if there was something outside of just that traditional cognitive rest. So first, what is known, a majority of patients actually recover from concussion symptoms within 2 to 4 weeks of the concussive event. However, there is an estimated 10 to 33% of patients that have persistent symptoms up to 3 months after the concussion, which is kind of crazy. The most commonly implemented intervention for concussion is that physical and cognitive rest, but as I've seen over the last couple months, is that a lot of the current literature actually will dispute these claims. The actual physical and cognitive rest was supported with consensus statements on concussion in sport all the way up until 2009, so it's still pretty recent that this has been implemented. And I kind of pulled this quote here from this article that I found, that 100% of cognitive and physical rest is actually difficult to enforce. To actually tell one of our athletes that are very active all the time to lay in their bed and not think about anything, and when you think about it in theory, it's actually going to be difficult for them to actually do. And then the actual symptom recording can be influenced if individuals have constant migraines or headaches, along with any kind of physiological factors such as anxiety or depression. And there is actually a lot of controversy when it comes to withdrawing athletes from exercise. Deconditioning can begin within 2 to 3 days of bed rest, which isn't very good for our athletes if they want to go return to play within that 2 to 3 week time frame. And to actually tell our very active athletes that they cannot participate in exercise anymore can be mentally debilitating. And like I said before, to actually turn off all your brain activity and tell someone not to look at a screen or send a text message can be very difficult. And a lot of literature does not recommend bed rest at all after a mild traumatic brain injury. And one of these flowcharts that I pulled from one of the articles actually shows that, like, if you provide that initial so you have that initial injury, you provide rest and activity restrictions, that deconditioning can begin to take place. But even more important, mood changes, stress, anxiety from our athletes having that activity withdrawal can ultimately increase their symptoms because of the effects that these factors can have on an individual's body. And then it can ultimately lead to that total negative feedback loop, which is what we don't want. So why are we providing rest as a common method of treatment when we know how unbearable and difficult it can be? Can aerobic exercise and resistance training be beneficial? So the simple answer is yes, it can. Moderate intensity physical activity has actually shown to decrease post-concussion symptom scale scores, and it can actually, it's believed to improve these scores as athletes are continuing to stay active, where they're not actually withdrawing from their sport. However, high intensity physical activity has variable information on it. It can decrease or increase or decrease post-concussion symptom score, but the overarching belief is that it does actually slow down the recovery from recovery of neurocognition. So can the recovery time actually be altered? A study from the University of Toronto very recently actually found that when patients partook in the aerobic exercise protocol within 14 days of their concussion, they had a more favorable recovery. They actually returned to sport quicker, and they returned to school and work quicker. And the interesting thing about this was that the aerobic exercise began when the individuals were still symptomatic. A meta-analysis performed in 2018 compared an exercise group to control group, and they actually found that there was a decrease in the number of days off in the exercise group, and it did improve post-concussion symptom scale scores as well. Leddy is a big researcher in concussion rehabilitation and exercise, and one of his articles found that when his protocol was done within 10 days of a sports-related concussion diagnosis, he found his exercise group to recover almost 4 days earlier than the stretching group, which is obviously beneficial. Those days can become beneficial if, depending on the point of the season that our athlete is in. And finally, one last article found that early physical activity was associated with a symptom duration approximately 1 week less than individuals that did not participate in physical activity. And now resistant training. There's actually very limited to almost no research on resistant exercise and concussion rehabilitation. The belief is that the Valsalva maneuver that we use with resistant training that provides that stabilization, it actually increases the intra-abdominal and intracranial pressure, which might not be good with individuals that have concussions. But it should be noted that this deconditioning and exercise intolerance within 2 to 3 days of bed rest is a big thing, and resistance training, there should be more research on the effects that resistance training can have. There was one article I found that looked at it was a review of a bunch of other articles on exercise, and they kind of created this graded combined aerobic resistant exercise care program. The actual program they had wasn't very realistic because they were saying how this should be completed up to 8 weeks. But the idea of it does make sense. We're changing a broader range of health-related parameters. Specifically, we're going to improve strength and aerobic capacity as well. So how can this be applied to our treatment plans? So these were the 2 protocols that I found, or that I pulled from research that had favorable effects on the recovery time of individuals with concussion. And you could kind of see the stepwise program used where individuals began slowly increasing their beats per minute to begin exercise, and they're using sub-threshold heart rate. The Buffalo Concussion Treadmill Test is also a very good indicator for individuals to determine their aerobic threshold for active rehabilitation when they do have concussions. And finally, just the consensus statements that were released in 2017. They took a bunch of the world's biggest researchers in concussion and they pulled them, or they kind of created 16 consensus statements. I pulled 5 of them right here. Specifically at the very end here, active treatment strategies initiated early in recovery, active can be initiated early in concussion. Furthermore, this 5th statement they made is that prescribed physical and cognitive arrest may not be an effective strategy for patients. So this can be an effective tool to add to our toolbox, specifically aerobic exercise, and it can actually help our athletes recover much quicker from sports-related concussions. Thank you.